Last week on Talk SA, we took a walk through the streets of Alexandra, the mother of all townships, and asked you if the residents have anything to celebrate. We also learnt about the bus boycott of 1957. Is this what made Alex so special?
Finally, we got the result we wanted. We didn't want to pay 4 pence. We wanted to remain at 3 pence. we got it right. I can say that was a success.
Many thanks to TTC Ver, who shared her post on our Facebook page. Remember, Mzansi, your comments help South Africa to keep talking. Today on Talk SA, we visit the Zola Clinic in Soweto. Brothers for Life introduces us to the new strategy to try and protect South African men. We also speak to some courageous men and boys who decided to go under the knife.
Circumcision uhambisana no correct, no consistent condom usage.
For South Africa in particular, the practice of circumcision has become a very topical one over the past decade. What with illegal schools being run, unqualified people performing circumcisions, and the mortality rate of the boys who are going up the mountain for whatever period of time prescribed. Now the excuse or the defense is that it'll make them real men. And on Talk SA, we don't criticize and we respect all our nation's different cultures and practices. But today, we're going to be looking at a different kind of man, a new kind of man, the kind of man who puts the health of himself and his community first, the kind of man who is socially cautious, responsible, and courageous.
I don't know much about circumcision. I just really don't. Yeah, apart from the reference to the Bible.
It's when you get circumcised, but medically, not like at the mountains.
They cut the foreskin. That's what I think. They're done by professionally trained people. So they're not illegal like the ones you have in our rural areas.
I actually went through it, which was kind of cool.
This thing attached to you, when you go to the mountains, then you become manly, and then now you're talking. It's just... I think that's why they prefer Huyago, the mountains.
I honestly think like when you go to the hospital, it's different. Like it's not the same as in going to the mountains. It's like you can't be considered a man, isn't like.
I guess it's a personal thing, but for me, I think getting a job and looking after a family, that's more what makes you a man than, you know. But I guess culturally, if you went to a very cultural society, it'll be different.
Yeah, so I think that's why who prevent that.
Like when you have to go to the bathroom, you don't really have to pull the skin back. That's probably as cool as it gets. That's
reduce your chances of being infected with HIV and AIDS and STIs.
Some people banana it prevent AIDS, but then I prevent the AIDS, but yeah, the chances that AIDS will be less, as far as I know.
Yeah, basically it's much healthier.
Just for him to stay clean, because I find it very disgusting for a guy to have foreskin. It's not clean. Yeah, it's not healthy.
It does improve your sex life. Like it becomes less sore. Like, it's not the same when you like having circumcised.
So it's better for a man to get circumcised so he can protect himself and he can also protect his partner, you see.
Yeah.
Brothers for Life have become a firm favorite here on Talk SA, partly because of their social mobilization. So this year, their mission is to mobilize toward medical male circumcision. They invited us to Zola to experience communal dialogue. We heard testimony and we witnessed a communal paradigm shift. Now, they always say that women have a bigger threshold for pain. But you know, the guys that I saw on this day should be commended for the step that they took.
sibona ukuthi kubalulekile kakhulu ngoba siyi-Brothers for Life sigqugquzela amadoda ukuthi awabandakanyeke ey'ndabeni zezempilo. Uma ungacabanga kahle futhi uma ungakhumbula kahle ayikho imikhankaso egqugquzela abantu besilisa ukuthi nje banakekele iy'mpilo zabo. So njengo-Brothers for Life sithi nayo i-medical male circumcision mayibe iphathi ye-primary health care ukuthi amadoda agqugquzeleke ukuthi aye emitholampilo angayi nje kuyosuka ujwabu. Kodwa mayobheka ukuthi impilo zabo zihamba kanjani and siyojabula ngelinye ilanga sithola ukuthi mamadoda awasasika ujwabu nje kuphela kodwa mawafike emtholampilo bayayenza lokho kuthiwa o health counselling and testing phecelezi okubizwa ngokuthiwa i-HCT.
Akhona mhlambe ama-challenges enibhekana nawo?
Ama-challenges esibhekana nawo ukuthi esikhathini esiningi uzothola ukuthi abantu abakazi kahle ukuthi i-circumcision le ayisho ukuthi ungasalisebenzisa i-condom. Ngoba uzothola ukuthi umuntu mhlawumbe uzwile nje ngo-circumcision bese ayagijima yo-circumcise bese azitshela ukuthi uma se-circumcisile usene-silver bullet usanaloko okuzokwenza ukuthi angaphinde abe naso isifo sengculazi.
But bakhona abantu abacabanga ukuthi uma uya esibhedlela uyosika ujwabu you aren't a man kumele uye entabeni. Nidila kanjani naleyo way of thinking?
Ngiyawubonga umbuzo wakho dadewethu engifuna ukuchaza kakhulu i-medical male circumcision nokuya entabeni izinto ezimbili ezingafanani. Uma mhlawumbe umuntu ethi yena ufuna ukuya entabeni ayoyenza khona ayosika ujwabu ngokuphelele asikwazi ukumvimba. Asikwazi ukumvimba kodwa kumele kucopheleleke ukuthi like lu safe luvikelekile. Esingakhuluma ngako esihlala kuko kakhulu yiloko esikwaziyo. Kodwa nayo circumcision akahambi yedwa uma umuntu engahlolanga. Umuntu kumele ahlole asazi status sakhe azazi ukuthi u-HIV positive noma akekho HIV positive. Uma i-HIV positive angacircumcise kodwa uzofundiswa ukuthi uzinakekela kanjani. Uma engekho HIV positive nakhona angacircumcise futhi uzofundiswa ukuthi uzinakekela kanjani.
Okay, so we're about to chat to Godfrey, and he's got a very interesting story. He's had a traditional circumcision as well as a medical male circumcision. So we're going to talk to him about why he chose to have the second procedure done and how he's feeling about it. Hi, Puti, kunjani? Angaphila. Mtshele bhuti wami, when and why were you circumcised for the first time?
Okay, circumcised in 2000. And when the circumcised and the nantika the tradition. Bakunyanzelekile uba manje circumcise ke ngokwesiko ke thina amaXhosa siyacircumcise usuke ebukhwenkweni ungene ebudodeni sisi.
And yini eyakwenza ukuthi emva kwalokho uhambe uyokwenza i-medical male circumcision?
Okay sisi ndaqwalasela uba i-foreskin yami isasekhona imbijana yayo ngoba ngoku ngendaba zezempilo yabo medical conditions ebendindaba nazo kwacaca uba funeka ndiyigqibezele ngoba uba bendihleli nalo elo jwabu ibizaba yingxaki ke sisi kuthi ndiyabanqwenela uba mabaye bayokoluka sisi mabaye bokoluka ngokwesiko xa ilisiko libavumela uba mabaye ngoba isiko nyani nalo libalulekile. Umuntu udibana nengxaki xa ungahambanga ngendlela le ukhokho bakho bahambe ngayo. Nangapha ngasesibhedlele sisi ndiyabagqugquza njengoba usitsho nje ndinqwenela uba mabaye bayokusika eli jwabu eli lisuke. Unobangela sisi kuba khona ngoku into esiyijongileyo isikakhulu ukwehlisa isantya esi-HIV.
Coming up after the break on Talk SA, we see just how brief the circumcision procedure is.
Everything, no pains, no necks. Very painful. Baya sir.
The Zola Community Health Center is getting busier and busier by the day. It seems that more young men are going for the medical male circumcisions. By the time midday had come, they'd already performed 70 circumcisions. And after chatting to Sister Elizabeth, she said that in one day, they can perform up to 150 circumcisions. We went and spoke to some of the patients. So you've just had your circumcision done. How are you feeling?
Very painful. It's by seer.
And tell me, what made you come today to get circumcised?
Van ek wil die rugs van AIDS moet afkom en ek wil nie sommer siek word nie.
Ngizizwa ngiright yazi. Mara amapeni awakabi khona yazi. Ya ngitsenza ubona nje masezithi intambama. Ya mara abanginikezile amapilisi ukuthi mangiphatha amapeni ngikhona ukwaphuza ngizoceda yeah.
Funa sibonisela ababancane esingilethe umntana kithi omncane naye ukuthi azokhathisa then ngizela ngizomsupporta ngiyange emsebenzini ngiza
ayiwenzeka nasekhaya bayasupporta ukuthi ni circumcise
bayasupporta
bayakufaka nje imithi bese bayak-injecta ukuthi nje ungafeel my pain ya bese khane bazokhatha le skin the full skin yakho le ya mara kuyayikho pain ayikho total mabak-cleanse.
Ububukele now?
Yeah, bengibukela ngithi ngikhona la kumele ngibone nami ukuthi bayikhipha kanjani lento lesi yeah.
Basically into enzakalayo when guys bafika lana baya lapha e-reception yethu then kulaba bhalisa khona from lapho then they come here which is this is our group information room. This is where we gave a group information about MMC. Then after they've got their information here, then the counselors, we do have a team of counselors where they'll be coming bazobathatha kena nga 1-1. This is our rooms lana ma counseling rooms wethu lawa. Then they will give them individual counseling where basically we observe whether the participant understood everything about MMC. If they don't understood, the counselor makes sure that that person understood before everything. We also offer them HCT. If they agree to do the test, we do the counseling part of it, then we counsel them, then they will go through that side where they will have the test. The counselors are not the one who are doing the pricking. So the nurses are the ones who are doing the pricking. Then the guys will go to do the pricking. Then after we go there and we collect the results.
So it's very easy, it's pre-packed already. We don't need to be sterilizing and be using. And everything in this pack, it's once off and they're disposables. When we open the pack, everything we use basically apart from the medication, it's in this pack. We've got 2 sterile gloves and then the apron to wear so that you don't stain your clothes. This is the blade that we use for the cutting itself. It's a retractable blade. It cuts and then we retract it back. It once off, we throw it away afterwards. This is a plastic tweezer to hold the tissues when we suture so that it doesn't get wounded by the tissue doesn't get wounded. So that's why we're using a plastic one. 2 sterile surgical gloves for the main procedure. A hot wrapping on the patient's skin so that the patient's body doesn't get stained with blood. And these are swabs that we use. And these are the instruments we use. Artery forceps, needle holder. It's got a scissors behind also to cut our suture material. We've got suture material for the stitch, for the suturing. We've got alcohol swab for cleaning before we inject. And then we've got a tape to elevate the penis to prevent swelling at the end of the procedure. And this is a syringe, 10 ml syringe, and 2 needles. We use the green one to withdraw the medication and the blue one to inject the patient. And this is the paraffin gauze for the dressing that we use. Thank you.
So Putami, uqeda ukucircumcise manje uzizwa unjani?
No, ke ikutlwa ke le sharp gore ke na bothata healthy ke sharp everything no pains no necks just.
And yini kwenzile ukuthi uze namhlanje uzo circumcise?
into entseng ke tle ka jeno ko re ne ke batla go ba healthy because it reduce HIV status go se be le di problem lo reduce le di problem tse ding tsa go no tla no be clean every now and then o gona go clean ka speed unlike how na le foreskin how gona bona ka mohare, and then I think the sexually is much better. Yeah.
We even have abantu abanabo 75 years who they come labazo circumcise. So,
and do the majority come nabantu abazoba supporter, or do they come by themselves?
Kakhulu bayeza ngabo, like abantwana besikolo yabana beza ngama groups, yabana amajita ama groups mhlamba thola information somewhere, then they will come as a group. But we always encourage ukuthi laba like from 12 years until 14, we encourage ukuthi abazali babe involved because they need ukuthi basayine a consent form before bazo circumcise. Even if from the good information session we need ama parents ukuthi beze bazothola the information ukuthi after abantwana baqedile ku circumcise they know ukuthi ekhaya bazobanceda kanjani.
I see ngiyakubona ukuthi passionate ngalento oyenzayo, you know.
Yeah. I'm here ukuthi ngizosisa umphakathi wethu, you understand.
Coming up after the break on Talk SA, we get more beneficial facts about medical male circumcision.
Because mina uyazi ngiyakunqanywa and nawe awunalilinye out. Unless if sewunalinye out ke ungaba. Well, you
There were a number of medical experts present on the day of the Brothers for Life event. We caught the attention of Dr. Thabo, who told us about medical circumcision and the benefits of having this 10-minute procedure.
You know, what happened basically is that around the early 1980s, there was an observational studies done in countries where men are circumcised, where majority of men are circumcised compared to countries where less men are circumcised. And researchers and scientists find one thing, that in countries where there's lack of circumcision, where less of men are circumcised, there's always high prevalence of HIV. Compared to areas where majority of men are circumcised, there's always low prevalence of HIV. Then, they want to, science how they're very good with this inquisitive mind. They wanted to find out what's the relation between circumcision and HIV prevalence, Is then when in 2004, they launched the 3 randomized controlled trials, one in South Africa, one in Uganda, the other one in Kenya. And all the results, what they said is that they found out during the randomized controlled trial that the MMC, or medical male circumcision itself, because some benefits in curbing the transmission of HIV.
Because mina uyazi ngiyakunqanywa and nawe awunalilinye out. Unless if sewunalinye out ke ungaba. Well, you
So, Dami, nifundeni la ekhaya namhlanje?
Baribadisitse hore circumcision it's not a substitute for condoms. Yeah, and ba re jwetsa hore circumcision reduce the STI and ka 60%.
And then kubo mama abantu besifazane ngithi kubo bomama khululani abo baba ngasezindlini base-circumcise because kithi abantu abesifazane i-foreskin kakhulukhulu play a role kithi ukuthi sibe nama-cervical cancers.
Engikufundzile namhlanje kuningi kakhulu ukuthi abomama bayakwazi ukusupporta like ama-partners wethu ukuthi si-circumcise sisebenzise ama-condom. Kushuthi endlini into engiyibonile noma ningacungaza na imali igcwala ibhavu ukuthi mfazi wami nayo imali, but if ikhondom awuyisebenzisa akayifuni uzokushilo imali igcwele la endlini ane akufuthumala endlini uma kube umbhede wenu awufuthumelanga ingagcwala imali ibe yiningi la endlini but empedini bakunomoya ongenayo esayidini uyahamba umama.
Kodwa uma wena uvuma engayifaki ikhondom uvume wena ukuthi umnikeze izithunzi zakho. Mistake ngicabanga ukuthi ngiyacabanga ngathi la kuthina nathi sibuye siyekelele sisebenzisa uthando sibona mhlawumbe bazoshiya partner bethu. Uma kodwa thina singaba assertive sithi ngeke ngize ngikunike ngisho ubone sekhipha amehlo ngeke ngikunike ungayifakile ikhondom. Uyobona ngamanye kuleke phambi kwakho. Uzoyifaka ngoba vele uyifuna.
And into esinikisa umdlandla kakhulu la ukuthi abantu bayazifunela. Abantu abayifunayo le service ngoba bayibonile ukuthi iyasebenza kumanye ama countries nala eSouth Africa izosebenza ngoba okusemqoko ukuthi sihlise izinga le HIV in South Africa li too much. Sikholo lokho la.
Hamba emtholampilo seduze nawe kumahala akhokhwa uyangena uthi ngizosika ujwabu bakuthathe bakufundise mabaqeda ukufundisa bakusika ujwabu bakutshela ukuthi uzinakekele kanjani bese ngemva kwaloko ubusu right. So madoda asiyosikana ujwabu.
Philani, so ucela ungitshela ukuthi kunjani circumcise namhlanje? Uzizwa njani? Ubuhlungu. But bakutshelile ukuthi yindawo kumele ucircumcise?
Ngitshelaka. Hayi akaswanga. Bamtshelile. Like lama disease la khona ama STD yabo lezo zinto lezi ya foreign nayo ukuthi ayi protective food. Angaloka yabo sekazoba indoda.
Usuyindoda ke mfana. Asikisi ngobuhlungu uzoba right yes wenza into right yes.
Your nation builders of the week this week are Brothers for Life, Chaps, or Dr. Mashiru. We would like you to post your comments on our Facebook page or contact us on our SMS line 33120. Next week on Talk SA, it's all about beauty pageants.
I will never ever let my child enter a beauty pageant. No.
Body accept, don't accept because other people's self-esteem.
Haile Selassie was born in 1891. He's credited for modernizing Ethiopia by transforming its government and institutions from a feudal system into a constitutional monarchy, as well as opposing and resisting Italian attempts to colonize Ethiopia. Selassie later succeeded the Emperor Menelik II as a ruler of Ethiopia on the 3rd of April 1930.